Brian Wong is going to join me in a moment. I believe he's going to share his project, Health Innovation and Entrepreneurship for Public Good and Social Impact, looking for case studies to be included in their paper. So Brian, if you are around, come on up to the stage. He's there. I'm so happy. Hey, Brian.
Hi, how's it going? Can you hear me all right?
We can hear you perfectly. Yes, great.
Let me just turn my video on. There we go.
Brilliant. That's also a good step. Yeah. Are you going to share your screen with us, Brian, as well?
I am. Just trying to work it out.
Great.
There we go. Can you see that?
Oh, brilliant. It's working. Okay. Thank you, Brian.
Great.
Tell us a little bit about yourself.
Yeah. So yeah, thanks for having us. So yeah, my name is Brian Wong. I'm an EIT Health alumni. I am currently working as youth officer for the Lancet Financial Times Commission on Governing Health Futures 2030, Growing Up in the Digital World. I've just landed in Geneva, so you'll have to forgive if there's a bit of extra noise in the background. I'm just grabbed my bag and hopped on the call. So yeah, so our project's on health innovation entrepreneurship for public good and social impact. It's about ensuring an equitable future for healthcare through fit-for-purpose digitally enabled health systems. So equality, diversity, and inclusion is a really core tenet of ensuring that the potential of health innovation and entrepreneurship can be harnessed for public good and social impact to achieve universal health coverage and health for all, and to ensure that no one's left behind. So in 2021, in September of 2021, during the European Health Forum Gastein annual conference, EIT Health alumni co-organized a workshop with the Young Forum Gastein on HIE, PG, and SI. And during that workshop, we had 8 teams come together to design solutions to tackle challenges on our health systems that they're facing through digitalization. So we were tasked with answering the question, how can we ensure that digital transformation will bring equitable access to healthcare? And after that workshop, a call was made to the Young Forum Gastein participants interested in continuing work on that questions that were addressed in the workshop. So following the forum's workshop, we came together in this interdisciplinary group as expert young leaders to work on a white paper aimed at providing a comprehensive framework for an equitable future of healthcare via digitalization. You know, where we think that this will make a really positive change because we brought together youth to carry out stakeholder engagement and really bring together this intersection of policy, business, and civil society, as well as bring together diverse voices. So we've decided to prepare a white paper to address these questions. And here's the team. As you can see, we're very gender diverse. We've got backgrounds in different health professions and are from across Europe. So really diverse lived experiences with different health systems. So I'd like to share 4 key objectives that we're aiming to achieve with this white paper by April 2022. The first is to address this 4th industrial revolution of digitalization that we're in and the future of healthcare from different perspectives, policy, business, and society. You know, second, we'd like to foster collective action, stakeholder engagement, and public-private collaboration for development and progress. We'd also like to empower young voices to become agents of change in digital transition and enable means for them to co-create with the health leadership in both business and policy. And finally, to advance innovation and entrepreneurship for equitable and inclusive health systems. We've teamed up with impactful partners to ensure a broader outreach and awareness led by the EIT Health alumni. This comprises the World Health Innovation Summit, HIMSS Initiative for Technology and Health Informatics Education for students and healthcare professionals, as well as the European Health Forum Gastein. More to come on that. So first I'll walk you through our white paper, kind of how we'd like to structure it. So the first chapter is equity, diversity, inclusion through a global lens. You know, and really we want to apply this global lens to make sure this global leave no one behind lens to digital transformations, which really means putting people at the heart of digital transition agendas in the pursuit to achieve the SDGs and the triple billion targets, as well as the goals set out in WHO's global strategy on digital health 2020 to 2025. As mentioned, I'm the youth officer for the Governing Health Futures 2030 Commission, and we recently launched our final commission report in the Lancet. So this second chapter is titled Digital Health for All, Governing Innovation in the Digital Transformations in Health. And this kind of is based on the framework that's set out in the commission report, in which we urge policymakers to address power asymmetries that are reinforced by digital transformations, and ensure that opportunities afforded by digital technologies and data are harnessed in support of the missions of public health and universal health coverage. And to achieve this, we've identified 4 key areas where governments and digital health actors must take collective action, and which will be used as a framework for this chapter. So the first is to address the roles of digital technologies as determinants of health, to build people's trust in digital health, to enact a solidarity-based approach to health data to increase its public value, and finally to invest in the enablers of digital transformations of health and UHC. Our next chapter is around fixing broken healthcare systems through tech and digitalization, and the pivotal role that innovation moonshots and purpose-driven startups can play in this. So, we believe that the role of innovation hubs and healthcare delivery organizations is really key to provide value for healthcare consumers. Additionally, there's impactful innovations which are tackling digital divides, that are observed in underserved communities, and the private capital has a really key role in financing the future of healthcare and achieving UHC. So again, going back to this public-private partnerships model. And finally, around digital maturity assessment of healthcare systems and services, and how key that is. Our final chapter sets out to kind of explore how we can change the world one health tech at a time. So for this, we plan to showcase 5 case studies, mostly EIT health startups, which are bridging the health equity, diversity, and inclusion gap via digitalization. And we'd like to make a call for case studies. So we'd really like to hear about your experience as a startupper. If you do indeed have a startup that you'd like to share your experience with us, and you can scan that QR code to submit your case studies. We'd love to hear from you. We'd also be collating a bunch of cool case studies that we can showcase in the follow-up once the white paper is published. I guess finally, we'd like to invite you to join us in our subsequent roundtable, where the entire team's going to be present. That'll be a really great opportunity to ask us questions, as well as provide us with any recommendations you might have for our future work. Thank you.
Thank you, Brian. Thanks for joining us. This sounds like a fascinating project, and I'm sure that you'll have a bunch of people who are going to want to talk about that and find out a little bit more. And are you at the airport at the moment, Brian?
I am. If you want to have a look. just chilling by the bag carousels. So.
Amazing. Well, nice work on a presentation from the baggage carousel.
Cheers.
Not many people could pull that off. Thanks for joining, Brian. So guys,